Hello, my name is Laura, and for my case study project, I'm going to be discussing sickle cell disease, also referred to as SCD later in this presentation, and specifically the cardiovascular system. So first off, some background. What exactly is sickle cell disease? Sickle cell disease is going to be a recessive hereditary disorder where there is a single amino acid substitution on chromosome 11 in this HBB gene. And what that means is that the GAG sequence of a normal gene will be turned into a GTG sequence. And that just means a circled, more plump looking, round looking blood cell will become sickled, C-shaped, and people have said that this is crescent shaped looking, which makes sense. So what exactly does that mean? It means that it will cause problems in the body and the red blood cells and blood vessels, which will be discussed a little bit later on. And one of the main issues that we talk about is sickle cell anemia, where there's a shortage of red blood cells since there's not enough healthy blood cells to replace the dying sickle cells. So now about the cardiovascular system, I decided to hone into the heart, and the heart is basically a pump that pumps around oxygen and nutrients throughout the body for the body's processes, and it's also by using arteries, veins, and capillaries. With that being said, I decided to connect this topic to topic 38 and 39. In topic 38, we discussed that hemoglobin carries oxygen in the red blood cells. So that means that each subunit in hemoglobin can carry one oxygen molecule, which means that one red blood cell can carry up to 4 oxygen molecules. And in topic 39, we talked about arteries and veins, and their purpose is to carry blood away and back into the heart. So for the connection, obviously red blood cells are essential for oxygen transport in the body. And in sickle cell patients, HbF is very widely used to treat SCD, and one of the potential cures, it's not solid yet, but one of the potential cures for sickle cell disease has been CRISPR gene editing, and they do that by doing some stem cell therapy or transplants. So in the cardiovascular system, it consists of the heart and the blood vessels. And to maintain oxygen and nutrients from going through the body, blood cells have to be flexible for movement in the vessels. And the heart has 4 main chambers that hold the blood, and that just maintains blood flow and healthy maintenance of organs. In the affected cardiovascular system, the sickled cells are going to be, as I said, C-shaped, but they're also going to be a little bit sticky. So when they're not round, they're not able to go through the blood cells, and they can cause these blockages shown in this image in the red blood cells. And what that can cause is inflammation, hypoxia, cardiomegaly, hemolytic anemia. And what that means is just cardiomegaly is a enlarged heart where the heart and the blood vessels will pump harder and harder, but without oxygen, it doesn't really cause much of a change. And for anemia, sickle cells have a shorter lifespan than normal cells, so they will die and the body will have less red blood cells than it needs. For the symptoms and management, the symptoms of this are going to be a lot of pain episodes, and that's just a lot of pain in the body and organ damage since oxygen is not able to go into the organs since there's blockages. And ways to manage that has been just medication. There hasn't been a cure yet, but as I said, the CRISPR editing has had a good impact on management so far. So in short, sickle cell disease is going to be a mutation in a gene that causes sickle cell diseases. The sickle cell disease is going to be called hemoglobin S, and that will just lead to blockages, anemia, and heart and organ complications. And yeah, Thank you for listening.